Yes, my name is Christian Karagiannidis. And first of all, thank you for this very kind invitation. And I will tell you a little bit the lessons we learned from the COVID-19 pandemic on our healthcare system in Germany. I have to admit that I'm the one who was running the ICU registry in Germany, and I'm a member of the COVID committee of the government, and also of the restructuring of the German hospitals. And I would like to give you a little impression what happened during the last 2 years, where we are, and also give some information about ECMO, how we did that in Germany. So first of all, what happened in Germany? And that is something which is quite new. And I put some data together, what was before the pandemic and how it changed. And these are some key diseases on the ICU, and you see the number of COPD patients, for example, at the same day on the ICU. That was a maximum 1,500 patients all over Germany. Germany has 83 million inhabitants. If you look at the flu season, and I guess you remember 2018, that was the strongest flu season we had before the pandemic began. That were nearly 3,000 patients on the ICU at the same time. But you see that's only a peak in the first 3 months of the year, and then the pandemic came. And that was an extraordinary stress on the ICUs in Germany. And you see that we had in maximum, we had around about 7,000 patients at the same time. And we had many waves on them, and that changed the system at the end. It didn't change the system in the beginning, but you feel that since several months now in Germany, we see all the consequences you have if you have to treat so many patients at the same time. I don't want to give you only a bad impression. We had also some very good points in Germany. And the first one was that we have a better awareness how important healthcare is. And that's not only in Germany, I guess it's all over Europe. It's especially intensivists, but also for perfusionists and ECMO therapy. That is very much in mind of the people now in Germany. Everyone knows that. And in Germany, the monitoring of the resources really strongly improved. I will show you. We have more technical equipment, which is good and bad, if you look at the ECMO systems. But the bad thing is that the staff shortage, and there was a problem even before the pandemic, increased very much now. And so let me start with the overview. We didn't have a registry in Germany. You know, I'm an intensivist, and I belong to one of the medical societies. And we tried that for several years. And the first one was in 2010. That was the H1N1 pandemic. And we set up a small registry. And the basic idea was to show the people if there are any spare ECMO capacities in Germany. So we did it in red, yellow, and green. If your hospital is green, you can take an ECMO patient. If it's red, you can't take it. That was the basic idea. And in the beginning, we had around about 40 hospitals who supported our registry only with this very basic information, if you can take a patient. And then we tried to increase that. We tried to get funding, but all attempts failed. And Germany has a lot of money. And we tried that once more in 2018 with this strong flu season, but we also failed. And then with the pandemic, we had this momentum. So no one knew the real number of ICU beds in Germany. So you know we have around about 1,500 hospitals who care for the patients, but no one knew how many ICU beds we had. And in light of this Italian surge, and especially from the Lombardia, and we were in close contact in the beginnings, the politicians and the public were a little bit panicked in Germany. And that was a reason why we had a great success within a few weeks, I would say. The expectation in Germany is always very high. Yeah? You don't get funded it for 10 years, but if you need that, you have to do that within 1 day. That's the expectation in Germany. And they want to have that as real-time data. They want to have that as a machine-readable, real-time data, and everyone wants to have that. That's the expectation of the German public. Not easy to handle if you are responsible for that. but we got some very, very important information about the ICU capacities and also about ECMO capacities we have in Germany. That is what is known before. That is the ICU capacities across Europe, and you know that we have the highest capacities in Germany and in the US, that we maybe have the lowest capacity in Israel, and Italy is also very low. Italy had around about 3 beds per 100,000 inhabitants. In Germany, we had up to 30 beds per 100,000, and that was the estimation we had before we started with our registry. And with this registry, we got some very important information. First of all, how large is the German ICU? And you know that we have some recommendations from the medical societies. And the usual recommendation, it's quite old, but the best one you can do is that an ICU has around about 8 to 12 beds. That's the best in terms of quality, stress on the staff, and so on. And indeed, the mean size of a German ICU is around about 10 to 12 beds. So this is what the recommendations from the European societies were before. We then introduced the quality of a bed. So there is, I guess, no discussion, for example, in the Netherlands. You will never certify a bed as an ICU bed if you cannot ventilate a patient. In Germany, it's different, and that is one of the reasons why it seems that we have so many beds. And in the beginning of the pandemic, we divided the ICU beds, and only the high care beds are the beds we are usually talking internationally about, and this is different to the low care bed. And low care bed, our definition is that you can do, for example, non-invasive ventilation, high flow therapy, tracheostomize patients, but you cannot intubate a patient. That's a huge difference. And then we introduced also the group of the high care beds with ECMO. It took me around about 12 months to explain what a bed is and what a free bed is. And it took me really 12 months to tell the people that you need nurses for a bed. That was really an interesting time in the pandemic. But after 12 months, everyone in Germany knew that a bed without a nurse is not a bed. And that was the first time that we really got an impression. And that is from yesterday or the day before, I don't know. And you see some very important points. On the left-hand side, these are the high care beds in Germany. On the right-hand side, the low care bed, or some say intermediate care beds. And you see that we have far less than 30. It's at the moment 9.6 per 100,000. You see also some peaks. These peaks are the peaks of the waves. The last one was the Delta wave. And you see that you can also attract some stuff from other parts of the hospital, for example, from the OR, from the anesthesia. And therefore, we could increase in some time points of the pandemic the number of ICU beds we had. Then we had a huge discussion, and we received some money from the government in case that there is such a huge surge that we cannot handle all patients. And every hospital had to tell the government how many beds they can recruit from the OR and so on. And this is the light gray. It is around about 10,000 beds. I don't believe that we can provide that, but that was what the hospitals told us during the pandemic. So now the bed side. We have still enough beds in Germany. As 10 beds per 100,000 inhabitants is by far enough to treat most diseases on the ICU, but you see the trend. And the trend is that we lost 25% of the capacity during the last 18 months, and that's mainly due to nurse staff shortage. That's a huge problem. You can say that you have 10 beds. That's okay for the moment per 100,000 inhabitants. But if you don't stop this trend, you have a huge problem at the end. So you die a few years later. Yeah, that's the key message of this picture, and we have to work very hard on that, because that does not only account for nursing, that also accounts for perfusionists in Germany. Yeah, we will see the same trend in the future. And we have to do a lot that we spare our resources. What is the reason? We are also asking why are the ICU beds closed? And you see, On the blue line is if you don't have ventilators. That was not really a problem in Germany. There was a time in the pandemic, in the beginning, there were a few hospitals who had not enough ventilators, but that was not really a problem. You have sometimes problems with isolation of the patients, but most of them have problems with the staff. And if you have 1,300 ICUs and more than half of them telling you every day that they close beds because they have not enough staff, that's a major problem we are faced with, and not only in Germany, it's also across Europe. We got some important information, not about the new patients, about the age structure. I put the actual age structure on the right-hand side. That's the Omicron wave now. There are more and more patients who have, let's say, more SARS-CoV-2 infection than a real COVID disease in Germany. It's at the moment, it's only half of them are on mechanical ventilation. And we got some very important information about ECMO therapy. Let me explain it a little bit. We have in Germany, we have for the emergency departments, we have 3 levels. And level 1 means that's it's a small hospital. It's important for the regional healthcare resources. And level 3 is that is called Uni and Max. That's the university hospitals, you know. And you see that we have on every level in Germany we have ECMO. And if you count them, we have 213 ICUs in Germany out of 1,300 who have ECMO. And then if you ask them how many ECMO cases did you before the pandemic, most of them did 1 to 5 per year. Most of them. Only a few centers did more. And if you look at the right-hand side, my impression is that you really need 30 to 50 per year to get a really high quality. And the worst I saw is how many ECMO devices you have per ward. And most of them have one. Imagine if the technique doesn't work. You have to crank really a lot, yeah? Because remember the pandemic, there were weeks and months that we didn't get disposables and so on. And if you have a problem with the machine, you crank or the patient dies. Huh? That's a problem. And that is a huge problem in Germany. You also can see how many ECMO cases we had. And on the left-hand side, you see in maximum it were at the same time point, at the same day, up to 600 patients on ECMO. You see also the capacities very high in Germany, but on the other hand, if you have high capacities, if you have a high number of patients on ECMO, and that were around about 10% of all COVID patients on the ICU, you have also a high mortality, and I will show you that in a minute. One good point is, and this is something we learned from the pandemic, that we should stress a little bit more the regional organization. That is the example of Berlin. Berlin has the advantage that there is only one very big hospital, that's the Charité. And the Charité had a coordinating function, and Berlin has around about 4 million inhabitants, and the Charité coordinated all the hospitals in Berlin. And that was very new. Usually in Germany, hospitals don't like to work together because it's more, I guess, it's not really a concurrent situation, but it's not that easy. But during the pandemic, it was really great to see that hospitals work together, and I love this very much, that we have this coordinating function also for ECMO and for the severe diseases, and I hope that we do that also in the future in Germany. If you have so many hospitals, we did also an analysis who really treated the patients. So, as I told you before, we have 1,300 hospitals, and if you look at the right-hand side, there are only 300 hospitals who treated 60% of all COVID patients. Then there are some more hospitals, 300 more, who treated 25%. So half of the hospitals in Germany treated nearly all the patients, and if they are on mechanical ventilation, it's even worse. You see that you need round about 250 hospitals, in maximum 500, in a pandemic to treat all the patients. What is the disadvantage? This is something which is usually not published in Germany. That is a benchmarking of hospitals. And Germany is a country who has difficulties with benchmarking. And in this case, we put all hospitals together and we try to adjust the severity of the disease and compare the hospitals, and you see that you have huge differences. And that's the problem if you have too many hospitals with ICUs and also too many hospitals with ECMO therapy. And we did some more analysis. These were the first 3 waves in Germany with patients on ECMO with COVID, and you see that our mortality was around about 70% all over Germany. These are 3,500 patients we analyzed in the beginning, and there was no change from the first to second or third wave. Only the number of patients changed a little bit. If you look at the survivor and non-survivors, so even the non-survivors were not that old. So the mean age was below 60. And you know that most of them had a single organ failure. So there is a structural problem if you have too many hospitals and too many ICUs doing ECMO, and the mortality is very high. I guess you know this publication from the registry, and we had a huge discussion that those who did ECMO before did the best job. Mortality was around about 35%. Those who started in the pandemic, the mortality was somewhere about 60. In Germany, the mortality was 70%, even more worse than those who started with ECMO in the registry. Nevertheless, some further good points. We stressed that a monitoring of the hospital capacities is very important. And last week we started in Germany. We now know every day how many beds of the hospitals are occupied in Germany. Everyone can see that, and that's quite high. We have at the moment, during the week, more than 80% of the beds are occupied. That will be very difficult in the winter. I guess we will see for the first time a full occupation of the hospitals if we have a strong flu season. And I guess that we once more cannot do all the procedures in the UR as we did in the pandemic, because hospitals will be full and we have no restrictions in Germany anymore. This is my impression in sum. I guess the pandemic had a huge impact, especially on the staff, and that is really the hugest problem. And I thought before that the German healthcare system has a high resilience because we have so many hospitals and so many doctors. But I guess we lost that, and this is mainly due to the staff shortage. But COVID only aggravated a problem we had before. That COVID made it much faster than we expected. And I guess if we want to survive, there is really a time for change, and we have to change a lot. That not everyone can do everything, and you really do not need 213 ICUs doing ECMO. Thank you for your attention.